But the year that we're concluding is not just about advocacy. On the inside of the Academy, there's a lot of work underway to really bring the operations of the Academy up to 21st century standards and up to par with really excellent business standards. We've had a lot of work to do over the past couple of years in that regard. And as is common and prudent business practice, over the past year, AAPA made changes in our longtime accounting firm, as well as our longtime outside legal counsel. After reviewing a number of auditing and legal firms, AAPA has engaged RSM McGladrey as our new auditing firm. RSM McGladrey is a leading national accounting and tax and business consulting firm. Following a similar review to that was done for a new auditing firm, we undertook a review for new legal services, and the outcome of that review was the engagement of Venable LLP as our new legal counsel. Venable is a nationally recognized firm, and they were chosen specifically for their broad and deep experience in the nonprofit arena, particularly with professional associations such as the AAPA. In the course of the review of matters relating to the governance of the organization and the governance structure as is described in the AAPA's bylaws and articles of incorporation, Venable identified certain matters requiring revision to ensure compliance with the North Carolina Nonprofit Corporation Act. And some of you may not be aware, but North Carolina is the state in which the AAPA was incorporated over 4 decades ago. Specific compliance issues were raised regarding the responsibilities of the Board of Directors and the House of Delegates as mandated by North Carolina law. The Board of Directors of the AAPA has requested guidance from Venable to ensure that the Academy is in all respects legally compliant. Specifics in much greater detail will be discussed at the House of Delegates this afternoon. Anyone interested in participating in that discussion can certainly attend, and I would encourage you to do so. Over the past year, we had opportunities to collaborate with a number of our physician and other partner organizations, and we're so pleased and proud to have a number of those organizations represented by their leaders here this morning, and Steve has introduced those folks to you. I'd like to share with you an example of an outcome of some of that work, that being AAPA's work with the American College of Physicians, and we worked together to develop a joint policy monograph that was released just last week on May 20th, and that monograph is entitled Internists and Physician Assistants, Team-Based Primary Care. This joint policy monograph states that physicians and PAs working together in a team-oriented approach, such as the patient-centered medical home, is a proven model for delivering high-quality, cost-effective patient care. And I agree. We're very, very pleased and proud of our partnership with ACP. That monograph goes on to state that reimbursement policies should recognize the PA role as part of the multidisciplinary clinical team led by a physician. I want to acknowledge the stellar work of PA Darwin Brown of Nebraska and the Academy's professional affairs staff and the leadership they provided in representing the profession and in representing the Academy in our work with our colleagues from the American College of Physicians. Thank you. Thank you to Darwin, and thank you to our staff. Steve mentioned that over the past year we embarked on a research summit. For far too long, the PA profession has, some would say, lagged behind our colleagues in other medical professions in conducting and publishing research demonstrating empirically the contributions and the value of the profession. We know we're great, and we know we're valued. Others need to hear that and see that as well. As a maturing profession, and at 45 years, it's getting more difficult to call ourselves a young profession. We're middle-aged. As a maturing profession, we must seek to solidify and forward a comprehensive research agenda about the profession and about the profession's impact on health outcomes. We owe this to the pioneers of the profession that were mentioned earlier, such as Dr. Eugene Stead, Dr. Richard Smith. We owe it to them to provide the information the profession needs to continue growing and to take its place among the key providers in the emerging healthcare landscape. Today, little empirical data exists demonstrating the impact of PAs as members of the healthcare workforce. Very little data exists documenting in any manner that we can generalize the impact of PAs on clinical outcomes, on health outcomes. As directed by the strategic plan of the AAPA, we began to change that scenario this year. One of the provisions of that plan called for the Academy to take the first step in developing a research agenda through a two-day summit, which was held on March 4th and 5th in the Washington, D.C. area. This summit involved many leaders in the profession who were joined by thought leaders and decision makers in healthcare delivery and in healthcare policy. These folks represented the private sector, the federal sector, philanthropy, think tanks. We really had a broad cross-section of individuals together for what was a really valuable and productive two-day conversation as a start to the development of our research agenda. The group that came together included staff and elected leadership from our partner organizations. PAEA, the NCCPA, and ARC-PA were very active participants in this summit. A key objective of the Research Summit was to reach consensus on key questions regarding the PA profession and to lay the foundation for a viable and vigorous research agenda for the profession. Participants heard speakers discuss the need for and substance of data that can be turned into information the profession can use to support our legislative efforts, our educational efforts, our media outreach efforts, and efforts to educate the public at large. Work groups focused on specific areas in which there is a critical and immediate need for PA research. This two-day summit created the focus for a formal research agenda addressing the profession's current and future research priorities. A proceedings paper detailing and prioritizing the key questions that emerged from the research summit is being developed. The board of directors actually reviewed next to a final draft of that proceedings paper at their meeting yesterday. The paper will go to final publishing in June, be available on our website, and we look forward to sharing that with you. So the past years included intense and effective advocacy efforts, a lot of partnering with other healthcare organizations, a lot of work on our internal operations, and taking initial steps in delivering much-needed, rigorous, PA-oriented research. We've also done a lot of high-visibility media outreach. So it's indeed been a very active and busy year, as it should be. You should expect no less on any year. We've put a brief video together to share some highlights of the past year, because I think that does it much more effectively than words ever could. So I'll turn to that now.